I want to thank the leader of our party, the MPP for Davenport, for putting this motion on the floor today. I want to thank our health critic, the member from Nickel Belt, for so articulately saying what is really at risk right now in this moment. It is the well-being of our hospitals. Let's be very clear.
Yes, it is.
Because you take these surgeries, 50% of available surgeries, and you hand them as a gift to Tory-run private for-profit clinics, you jeopardize the funding of our hospitals.
That's right.
And do you know who's not fooled, Speaker? Rachel Muir is not fooled. Rachel Muir is the president of ONA Local 083 back home. She leads all the nursing units at the Ottawa hospital campuses. And Rachel texted me Friday night with, guess what, Speaker? Revelation. A private for-profit clinic was going to be operating for the first time the following morning at 7 a.m. at the Riverside campus of the Ottawa hospital.
Wow.
She learned about it because members of her union had been approached, as the member for Ottawa Stupian just said, in the hospital, near the ORs, about whether they would work in this private for-profit organization running out of a public facility. So I just learned, Speaker, if you're a healthcare professional, how you get a raise under this government. It's not at the bargaining table with Bill 124 and all the assistance they give their lawyers fighting people in court.
Right.
You go for $100 an hour and you work for one of the private operations run by one of their friends. That's how you get a raise from this government. Well, guess what? Rachel sees through you. You know who else sees through them, Speaker? Mary Elena Fox. Mary Elena Fox is the recording secretary of QP 4000. That is the group that represents almost all the workers at the Riverside campus of the Ottawa Hospital. Did anybody ask people in administration, housekeeping, patient transportation, food services, trades, nursing, personal care attendants, and orderlies, were any one of these people approached by the Ottawa Hospital, this government, the Ministry of Health, before they embarked on this for-profit experiment in our public system? What do you think, colleagues? Were any of them approached?
No.
Not a single one. And yet they'll call them heroes in this place. I just heard it over there. We love our nurses. We love our orderlies. It's a load of nonsense if you walk into their workplaces and disrespect them. But this Thursday, the nurses are rallying outside the Sheraton Hotel here in this great city of Toronto, and the members of the Democratic Party, we are going to be with you, nurses. We're going to be with you, CUPE. We are going to take on this government and embarrass them the way the education workers of CUPE did in November. Get ready for a very, very hot winter.
There you go.